Hi, Mr. Stafford. I'm glad that you found us here. Since we're not located at the wound center, we're located at the surgery center. So since this is your first appointment, today we're going to have you fill out this questionnaire. This is just reminding you that you cannot have any personal items in the chamber that could cause a fire. So no glasses, no wedding rings, no jewelry, no oils, perfumes, no toupees, wigs, anything like that. Okay, so I'll let you fill that out. Every day you will get a new gown and you'll get a hairnet because we do have to go behind the OR line. We'll start out with 2 blankets. If that's too much, then we don't have to do that, but most people get kind of chilly. So I'll let you change. Make sure to wash your hands. Don't use this soap. Use the alcohol-free soap that we have here because alcohol is flammable. And I'll be back to get you shortly. All right, so we are going to take your vitals before and after each treatment. We have to have your blood sugar at 120 to be able to go into the chamber because some people's blood sugar will drop up to 100 points while they're in there. So we'll go ahead and raise you up. We do have TVs mounted on each of our chambers and you will be able to hear it once the chamber clicks on. You can choose whatever channel you want. We have basic cable, so you can choose what favorite channel. You'll be able to talk to me. I can only hear loud noises if you need to get my attention and I'm not already looking at you. So knock on the chamber if you need me and I have a phone, I'll pick it up. I can change the channel or whatever you need me to do. Keep in mind if you do want to get out, I need a little bit of notice because you're not gonna be able to come out just right away. Okay. It'll take about 8 minutes for me to get you out of the chamber. All right. We're going to try to push you in here. It takes a second to get you situated. And you know how to clear your ears. You went over that with the nurse practitioner before you came in, correct?
I did.
All right, if you have any trouble with your ears, we can stop at the pressure that you're at and we'll try to adjust them, okay?
Thank you.
All right, we're gonna hook you up to what we call a grounding cord. It just makes sure that you don't have any weird electrical currents going through your body. We'll hook you up to that and into the chamber. And then we'll test it with this button that you press. Okay. And then you are ready to go in. Each treatment takes an hour and 48 minutes in total. It takes 10 minutes to get down to the depth of pressure that you're prescribed, and it'll take the 8 minutes to come back up. So your treatment time is 90 minutes in between that. How was your treatment today?
That was fine. It was a lot better than I thought it would be.
Did you get a good nap?
How did you know?
Because I sit in between the chambers and I watch you the whole time to make sure you're all right.
It was very comfortable, so I'm glad you gave me the advice ahead of time. Thank you.
Great. Now we'll just do your vitals and I'll take you back to the changing room and you're free to go.
Great, thank you.
We get a prescription from the doctor to heal the wound that you have. Then we usually take you down to 2.0 ATA, which is atmosphere pressure absolute. And what that does is it puts pressure on your whole entire body, and so it puts pressure on the cells. And then the cells are able to leak the oxygen out into the plasma, and the plasma can then go to your wound easier and heal it faster. So most of the people that we put in the hyperbaric chamber are diabetic foot wounds. We have a really large population for that. It has to be what we call a Wagner grade 3, which means it's a pretty deep wound that just won't heal. Usually we use this in adjunct to surgery debridement and also with skin grafts, and it helps the skin graft to heal faster and actually helps it to adhere. We usually do treatments with the skin grafts that fail to try to get them to adhere so they're not an actual failure. Osteomyelitis, which is infection of the bone, is another one that we can use hyperbarics for. We use it for radiation injuries for people that have had cancer and had radiation, and usually that happens in like the bone, the jawbone, or it's a soft tissue injury that just won't heal. We can use it for carbon monoxide poisoning, cyanide poisoning, but that's not very common. We have 2 beds, so we can dive up to 8 patients a day, 2 at a time. So that leaves us with a lot of room to get people in if we have somebody or a poisoning where there's multiple people that happen. For carbon monoxide, there's latent effects, so they need to go to the emergency room first and be evaluated, and then they need to be referred over here from a physician. They will first get oxygen, of course, and they will stabilize them there, and they have up to 3 days to come and dive to prevent the latent effects. We actually have some printouts with more thorough information, but we just got these handy little things, and they have the wound care number, and they also have the direct line to the chamber room, and most of the time the chamber room is forwarded to my cell phone, so you should always get me. And then on the back it just has information for what we treat. There's also things that we treat that are not on here, but if you just call me, we can try and see if we can get insurance to cover it. You can just call the surgery center if you would like more information, or you can call my direct line and I can get it to you. You can come by anytime. We're open Monday through Friday, 8 a.m. to 5 p.m. We're located at the surgery center, which is right beside the Quest for Life on Morganton Boulevard.